It's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about orthodentists. And don't get an orthodontist confused with an orthodontist. Two different things. Now, if you are marketing an orthodontist in your practice, you need to be very careful in how you market an orthodontist. It's not the same thing as an orthodontist. An orthodontist is a general dentist who does only ortho. So you can't say practice limited to ortho because that would be overstepping. So talk to your attorney on how you phrase it, because each state is going to have their own Dental Practice Act and their own laws, and I do not want to tell you how to phrase it. I've seen how some people do it. I'm not sure if it's legal or not. But yes, you can totally be a general dentist who does only ortho. You just need to make it crystal clear that that's who you are and that you never did go to a residency, that you are just preferring to do orthodontics. Now, a lot of GPs and even, a lot of DSOs and even a lot of orthodontists hire orthodentists to help basically get things rolling in their practice. Now, I don't recommend that the orthodontist does the treatment plans. I know plenty orthodontists, high-end orthodontists that employ orthodentists to do their bread and butter. You know, they're basically there to supervise, they're doing aligner checks, they're taking braces off, they're cleaning up extra flash, they're cleaning up glue, they're detailing, but then they're also there, you know, a lot of times orthodontists have patients that need like bondings and veneers in their laterals or restorative work, and unless the patient was referred directly from a specific GP who was asking for that cosmetic work, you know, it's okay if you have an orthodontist in your practice who also likes to do restorative work. You can also have the orthodontist be responsible for a hygiene sub-practice within the practice. It can be a cash hygiene practice. You can do a lot of things because it is really convenient to have your patient's teeth clean. Now, of course, I'm going to warn you, if you start dipping into GP world, you're basically now a multidisciplinary practice. You're going to stop getting referrals from GPs out there. But, you know, a lot of orthodontists don't care. So, you know, they're like tired of marketing anyway, so this helps to feed their practice. So tired of fruit baskets and everything. So, you know, it's really depends on what direction you want to go. But orthodentists are going to be a heck of a lot more affordable than orthodontists. Orthodontists are going to ask for, you know, $1,400 to $2,000 a day plus bonuses. Whereas an orthodontist might be fine with $700, $800, $900 a day. You know, about half the price, maybe some bonuses if they help to sell some cases. So I think it's a smart move. And I work with orthodentists all the time. Matter of fact, I work with plenty doctors who own their own practices. Maybe they're a little on the older side, not old because I'm in my 40s, but, you know, old for dentistry, where they've decided, hey, I really enjoy ortho. I don't want to do this bread and butter dentistry anymore. I'm just going to do only the ortho, or maybe ortho and implants or something, the lucrative high-end specialty work in my practice. And I'm going to let the young whippersnappers do all the bread and butter work and the hygiene checks. So nothing wrong with that. Matter of fact, it's a super brilliant idea. If you own a practice, I highly recommend it. You're going to retire much more comfortably than you ever would and do a lot less work, and you're going to enjoy things better. So, and that's something we can definitely train you up on. If you're interested in learning to be an orthodontist, it's going to take a few years, you know, of helping you with your cases and finishing. Basically, it's basically residency. You know, it's exactly what we do in orthodontics residency. We're there for 2.5, 3 years. We start a ton of cases and we finish a ton of our own cases as well as other people's cases. And we learn from the cases that we do and we learn as we go. That's what we do in residency. That's all a residency is. You know, it's not just sitting in classes all day long. It's just doing cases and learning about the cases that we're doing and doing a little bit of everything. You know, so the more cases you do, the more you're going to learn, because there's only so many iterations and variations of ortho out there. Eventually, you're going to start seeing things repeat itself. And your mind is like, oh, it's kind of like taking the SAT, you know, like if you take the SAT practice test enough times and you have support or you're making sure you're making corrections on the stuff you're doing, eventually you've seen every single question that's there. It might be slightly different variation, phrased a slightly different way, slightly different words. Slightly different numbers, but it's the same darn question. So you just basically blast it. It's easy, right? Same thing with ortho. The more we do, the more we've seen and done, and you know what to do. You're like, boom, I've done this before. This case is just like so-and-so's case last year. I remember exactly what to do. I remember what the tricky parts were. I'm going to do it the same way, you know? And you basically just have your own little plan on each different type of case. And, you know, that's something we can definitely help you with. We can tell you what we would do and why we would do it. But like I said, any ortho mentor that you work with is going to do things slightly differently. And you're going to notice that they have different ways they like to do things, whereas I'm super non-extraction, airway friendly, always focusing on forward growth, making things wider, better airways, facial profiles. There's a lot of people out there that just are out there to be sloppy and do things fast and take teeth out, you know, and they don't really see the value in an airway. So whereas I do. So, you know, that's how we do things. But very rarely does a case completely stump me. I mean, if it's so difficult, it's probably a surgical case, and I'm not going to try to do it with regular braces or aligners if it's a surgical case, you know, if it's a hard surgical case. So anyways, all right, hopefully this was helpful. And if you're interested in learning more about being an orthodontist, feel free to reach out to us. Thanks.